In this final episode of issues focusing on primary healthcare in Nigeria, the harrowing experiences of Loveth Owomodiowo in Lagos and Amadu Silibi community in Borno State serve as a testament to the urgent need for comprehensive healthcare reforms and practical solutions to improve Nigeria's primary healthcare system. In September 2020, Mrs. Loveth Owomodiowo, a 38-year-old wife and mother of 3, complained of an ulcer, prompting her to visit a primary healthcare center in Lagos. This marked the beginning of her troubles.
The vacuum when Loveth leave, the thing dey pain me. I really miss my pikin. I miss am, be say I no go see am again now. Why I want to see am? He don die. My pikin use him leg go Lagos. He use coffee come back. The thing pain me. So if I dey hear the noise of ambulance, I go shock. Hey, na my pikin be that. Hey, I really dey miss her because the things wey me and her dey do, the talk wey me and her, all the arrangement, all the many things, discussion, experiences of life when we don pass through, when we dey talk, how she dey pet me, go tell me say, "Mommy, don't worry o, when I don get money, I never get o, no worry, you suffer for us o." All of them now don lost.
I was informed about everything that has to do with me, Mrs. Loveth. And I can say without missing words that everything about that pregnancy was healthy, was normal. Every parameter that can make someone to think otherwise that, oh, she's not going to likely make it, or neither will the baby make it. There was no such parameter. And to make the whole matter worse, this pregnancy was actually detected in the particular hospital called Asjolat, the Agege branch. The first test to confirm that this lady was pregnant was in that hospital. Everything about the antenatal process was well fulfilled. But from the story I got, one, when she fell into labor, when she ruptured, broke her water, she was taken to the hospital. On getting to the hospital, they noticed she was not having, contraction. And before they got to the hospital, she went into the hospital with PCV of 39%. And that is a good PCV for a pregnant woman. But the mismanagement comes from the father. One, the consultant obstetrician was actually not palpable, was not on ground. But whatever that was done on Mrs. Loveth was more or less based on phone conversation.
Oh, Nigerians, judges, lawyers, everybody wey know say they dey born pikin, una stand up for justice now. I dey cry every day. If you learn na mebe lowai, awe hospital na watere ho, uri omo me, ejekugbo, ededo omo me, rokomai, emeware yeruru. Judges, lawyers, in the courts, Nigerians, muna stand up, muna give us justice.
With more resources and a better primary healthcare system, perhaps Mrs. Owomodiowo would still be here, watching her children grow up. We would never know. What we know for sure is that funding, technology, and policy making can greatly improve the plight of Nigerians like the late Mrs. Loveth Owomodiowo. Experts stress that funding plays a vital role in the delivery of primary healthcare, directly affecting the accessibility, quality, and sustainability of health services.
Primary healthcare is the entry point into the healthcare delivery system for any country. So getting it right is critical for achieving any form of universal health coverage. And one of the biggest challenges of Nigeria's system is funding across board, from the primary, tertiary, secondary, and the primary, secondary, and tertiary level. I mean, it's funding issues. So the biggest challenge is that there is no sustainable funding mechanism for the PHC system, as it were. Right now, it's mainly funded by government at the state and federal level, but the funding is grossly inadequate. We all know our health budgets is always very poor. WHO pushes 15% of the total budget, but we struggle to get between, sometimes go as low as 5%. I think this regime made it like 7% or 8%. I forgot the exact, but it's far below what the WHO recommends. But here's the thing, and I keep saying this, even if we had 100% of Nigeria's budget for health, it will not be enough, because the problem of health is massive. So we need to find another way of funding the health. You understand? It's not to government fund, of course, because of what it is. But we need to find another means of getting funding which is sustainable for the healthcare. And what the government has tried to do is to introduce health insurance scheme, at the private level and at the social level.
Now, let's take a look at some interesting facts. The 2017 Nigeria Healthcare Financing Policy and Strategy paints a picture of inefficiency in health spending. Since 2010, more than 90% of the total health expenditure has been spent on recurrent costs. In 2014, a mere 20% of the total health budget was allocated to primary health care, while 80% went to curative care. Public health facilities are plagued with high absenteeism rates of about 29%, with healthcare workers seeing an average of just 3 patients daily. Drug shortages are alarmingly common, with stockouts occurring 67% of the time for essential medications. Essential drugs are out of stock 67% of the time. Emphasis on essential drugs, and only 25% of primary healthcare centers have basic minimum equipment. Wow! Just so you know, these figures were obtained from Nigeria's Healthcare Financing Policy and Strategy 2017 document, not from a politician, not from a health expert or public affairs analyst. Trust me, we can do better.
With regard to the funds are available, but we currently have issues with transparency on the utilization of the funds. So when we are saying the funds are limited, the limitations of the fund borders first on the proper accountability of these funds, and then we can now talk about the utilization of the available funds. Now, talking about the utilization of the available funds, there are several aspects of the facility, healthcare facilities, that needs to be funded. We are talking from the perspective of the personnel, we are talking from the equipment, we are talking about operational costs and all that. So, like we mentioned, when it comes to transferring the ways in which you can operate a facility into situations where you are using electronic health records and using technology to facilitate it, the funds can be better utilized in this way. When we can transfer what we are doing manually to electronic ways, that means it's easier for you to teach in remote locations medical personnel. It's easier for you to see people remotely, therefore allowing easy accessibility of specialists into remote areas. So that also means that the limited healthcare resource can be better utilized in the system. So if we look at it from this perspective, if you invest into technology, it will help us be able to use the available funds more effectively.
The story of Loveth Owomodio is one of many in Nigeria, notably occurring in Lagos, a major African financial center and the country's economic hub. Lagos is expected to set a standard for other states. Now, if such issues persist here, What does the future hold for Nigerians, especially those in remote areas?
Government needs to put in place a policy that allows people to have unfettered access to health. One of it is to have the health insurance put in place. Gone are the days when people will think that they can go into any hospital, access it without paying funds. We have gone through that, and we've realized that health can be very expensive to be able to maintain and sustain it. And health is an abstract. It's not something that you measure. It's something that is a gift. You can't say, I'm coming to buy health, 10,000. I'm coming to buy health, 20,000. It comes in its various dimensions when it hits you. So keeping healthy is different from I'm accessing health to cure a disease when things go wrong. There are levels of and dimensions of it. When you prevent it, you are talking mainly about those who will give you everything you need to know, educate you well, so that you can take choices or make choices that will enhance your health. That on its own is part of health care behavior that government could have funded. But if you already have made a good decision towards your health in enhancing it, that is a minus problem from government. So we have that. We have the health insurance, we have the hospitals, both the tertiary, secondary, and the primary health center where you seek government this. And then the environment around you also are contributors to health. So the two of them also are married together in an ecosystem that needs to be balanced up.
There is also the pressing need for innovative solutions where technology can be instrumental. For example, health tech could have enabled timely access to medical expertise for Loveth. The same applies to areas with inadequate healthcare infrastructure. Digital platforms can assist healthcare providers in remotely monitoring chronic conditions, prescribing medications, and offering health education, potentially averting medical emergencies or complications.
The role of healthcare technology in the healthcare system is very immense. It's very clear that every industry in which technology is involved, it's able to facilitate and help those industries grow beyond what their capacity is. So in Nigeria, healthcare tech is a growing field, and it has a very pivotal effect in improving the healthcare system. So we expect that as new health tech companies are coming up and they start implementing the various products and services that they offer, it's going to make healthcare more affordable, more accessible, and create some level of healthcare equity.
In Nigeria, the healthcare sector faces significant challenges when it comes to making and implementing policies, despite sincere efforts. Bureaucracy and the occasional lack of political commitment often hinder the effective execution of these policies. Poor regulation, corruption, and competing interest further complicates efforts to enact meaningful change.
There is a flow. I know I mentioned something about flow in referrals. Yes. You start from the baseline. Primary flows into secondary. Secondary goes into teaching. And that was what we were practicing in those days of Olukoyere and Somkuti, in those days back then. The primary was supposed to catch you primarily, and then if anything that goes beyond them needed to be escalated to the secondary, then we have the referral letter sent in. And then also, if there is something that needs further investigations, at least onto a teaching level, then you go to the tertiary. By that time that you say you are going to teaching hospital, mama, they know your case has been something that people are teaching. And true as it is, you will see so many students around you. But you see, we've gone beyond that. Various hospitals offer the different levels of care, even at the same time. But one thing I want to say is that I don't know what we could do. I believe that we also could help by providing the enabling platform. As the permanent secretary then, I asked that there should be a mapping of all my functional 300 and something primary health centers in the various local governments, and I asked, where do they flow? What is the nearest secondary health facility to them? Which means I'm having, like, for instance, some small places, I have maybe about 5 primary health centers flowing into a secondary health facility, which means that referrals should come from them and they flow into that secondary. Now, my question is, do those centers in clusters have the capacity to accommodate the flow in referral from them?
They seem to be doing well, but again, because they are fragmented, I keep saying fragments don't help, you understand? You need something that is concerted and that can be done on a larger scale, you understand? So, but we know for a fact that public-private partnership brings efficiency, brings transparency, brings accountability in the system. So government needs to begin to look at how you can begin to run those PHCs as PPPs, and that would be a very good way to go to address accountability and transparency.
While the issues may be linked to policy implementation, it's crucial to acknowledge that there could be deeper, more intricate factors at play. Exploring alternative possibilities could lead to a better understanding of the true nature of the problem. But remember this, the fact that National Health Act has not been implemented in Nigeria is a significant bottleneck to achieving universal health coverage. This is because reaching universal health coverage necessitates wide-ranging reforms that tackle data collection, funding, accountability, transparency, and cooperation among all parties to guarantee fair access to healthcare for all Nigerians.
What health insurance will do is that it affords you the opportunity, or affords anyone in universal health coverage, that, see, it doesn't matter who you are. If this thing is in place, you can actually access health, because there's a belief that if all of us are partakers of this and we all do what we need to do, then at any point in time, people can rise up and say, oh, I need to go to the hospital, and they have the guarantee that they will, as they go for that health-seeking behavior, they will receive what they want there.
As the world rushes to achieve universal healthcare, Nigeria is grappling with yet another cholera outbreak in 2024. Despite intensifying its response to the cholera outbreak, the disease has so far claimed over 100 lives from 3,623 cases recorded in 34 states and the Federal Capital Territory. That's according to the Nigeria Center for Disease Control and Prevention, NCDC.
In addition to the ongoing outbreak of cholera the country is facing, we have observed a significant increase in the reported incidence of some other epidemic-prone diseases, such as yellow fever. We also know that Lassa fever and meningitis, though we scaled down the emergency operations center, we are still seeing some cases, but not as much as we used to be seeing. So on the cholera, it should be noted again that since June 2024 this year, when we alerted the public, the federal government of Nigeria, through the Nigerian Center for Disease Control, has been actively responding to cholera outbreak, which has had a significant impact on the health and well-being of our country, in our country.
The NCDC has stated that the reporting of the cholera situation is not accurate due to a lack of real-time data from the states. They attribute this to insufficient resources for disease surveillance and detection at the local level. There are concerns that political factors may be affecting the reporting of cholera, as some people view it as a stigma or a sign of the affected community's individuals' inability to access clean water and other basic necessities. One of the drivers of poor access to healthcare in Nigeria is poverty. Financial constraints often prevent access to basic needs, essential services, and medications. According to a Forbes report in 2023, nearly 90 million Nigerians live in extreme poverty. About 4,000 of them die from malaria every week, predominantly children and pregnant women, accounting for 31% of the global total. With almost 2 million people living with HIV, Nigeria has the third highest number of HIV-positive individuals in the world. Additionally, the country has the highest number of people with tuberculosis in Africa. While we are alarmed by the figures, it may surprise you to know that in some parts of Africa's largest economy, are we still Africa's largest economy? There are no primary health care services available for the people.
Kirma bika bunyara make kamula ganala suro sha zamzu isa umali lida ngurodun wa barada moto manyen fandende nafe manye mafe magonyo luyana kamul makalala yen sombo ari sigi gwamnati angodo nyen marti gwamnati a kungiya gade ande bana jin mambema bana kala da manyan litari manyan.
Gaskiya muna da ma karancin makaranta har ga Allah. Ya muna da yara da yawa a cikin anguwa da ba sa makaranta, muna buƙatar mu ga an mana makaranta da kuma taimakon asibitin.
Ku isi ko bikela ya gna ta awla ya biya tamtam tu so sudin lorsan da kala data machine alhamdulillah kala ne riba fandi na ala kuma da shimalo da jama me ya da settlement ro sha sudin ala kuma da duriya anza bara asir ala ya shi dikani ma kolzu.
Even though access to a primary healthcare facility is fundamental for every community, the people of Ahmadu Silibi in Borno State have none. They have been desperately pleading with the state and federal government to provide them with a hospital. The absence of such a medical facility has led to tragic loss of lives and forced residents to endure long, arduous journeys in search of medical assistance. To compound their challenges, the community is currently dealing with the devastating cholera outbreak that has already claimed hundreds of lives.
70% of infectious diseases in the world, believe it or not, can be prevented by just washing your hands. If you don't have access to clean water to wash your hands, you can use hand sanitizers to clean your hands till you get to a source of clean water. Number 2, make sure you boil the water that you drink if you're not sure of the source, or you can put chlorine tablets to purify your water. You can filter water to make sure the water that you drink is not contaminated. Another thing you can do to protect yourself is to make sure you cook your food thoroughly. Avoid eating food that is raw and uncooked. When you buy your fruits from the market, make sure you wash your fruits and vegetables with water that is not of questionable sources. If you're unsure, you peel your fruits before you eat your fruits. If you identify anyone with any symptoms, please make sure you get the person to a healthcare facility. If you develop these symptoms, diarrhea, sometimes vomiting, make sure you get yourself to a healthcare facility so they can take care of you, administer the right treatment as soon as possible so that we can save more lives as possible.
Lack of hospitals mean an absence of healthcare workers in the community, which raises concerns about who is disseminating vital health information, particularly regarding education on disease prevention such as cholera. This situation is truly disheartening, especially for residents of areas like Ahmadu Silibi and other communities who live without medical facilities. To rebuild and improve health systems, the World Health Organization recommends, unsurprisingly, the reorientation of these systems using a primary healthcare approach. About 90% of essential universal healthcare interventions can be delivered through this method, potentially saving 60 million lives and increasing the average global life expectancy by 3.7 years by the year 2030. Strengthening Nigeria's primary healthcare also means putting the Abuja Declaration into action by increasing domestic health resources and improving budget allocations for the management of the primary healthcare ecosystem. By reallocating healthcare funds from curing illnesses to preventing them, we can boost primary healthcare infrastructure, address the migration of rural health workers, and guarantee that all Nigerians have access to universally acceptable healthcare services. Finally, the potential of technology to transform Nigeria's primary healthcare sector is enormous. With the right implementation, it can reshape how healthcare is delivered across the country. By consistently investing in technology and infrastructure, Nigeria's healthcare sector can become more effective, efficient, and accessible. Introducing health tech, particularly at the primary healthcare level, will provide round-the-clock support and truly enhance the health and well-being of millions of people nationwide. Join us next time in this series for another episode where we focus on the issue of food and agriculture in Nigeria.